Welcome back. Now, the COVID-19, the National Institute for Communicable Diseases says that another 13,246 new COVID-19 cases have been identified in the latest reporting period. And that represents the highest number of daily cases and positivity rate recorded in January since January 2021. And a further 136 COVID-19 related deaths have also been recorded. And that brings the total number of fatalities in the country to 58,223. And most provinces in the country are experiencing a surge in COVID-19 infections. KwaZulu-Natal and the Western Cape have recorded more than 300,000 confirmed cases, with Gauteng leading the pack with more than 500,000 cases. So this morning, we turn our focus to the provinces and also how they are responding to the latest surge in COVID-19 infections. And we're joined by KwaZulu-Natal MEC for Health, Nomagugu Simelane-Zulu, and her counterpart from the Western Cape, Nomafrench Mbombo. And let's just see if we have both of them ready for us now. I know the MEC for KZN is with us, and let's see if the Western Cape MEC will join us when she is ready. But MEC, good morning, and thanks so much for being with us.
Good morning, Sakina, and good morning to your viewers.
And I believe the Western Cape MEC, Nomafrench Mbombo, also with us now. MEC, thank you for your time as well.
Good morning, viewers. Good morning, Sakina.
So let me start with the third wave question and just how confident you are as MECs that your provinces are in a good position to actually deal with the surges that are currently happening. Let me start with the MEC for KZN.
Thank you very much, and thank you for having us. Look, we have been on the lookout for a while now for the third wave, and we prepared right from the end of the second wave so that when the third wave hits us, or if it does hit us, we are ready. What we did immediately after the second wave was to sit down and look at what we have done or the strategies that were implemented during both the first wave and the second wave, and we had to learn from those. So in essence, I can effectively say that we are quite ready for the third wave. But, you know, the second wave as a province of KwaZulu-Natal hit us extremely hard, and the lessons that we believe we learn there will be able to put us in good state during the third wave. We are quite ready. We are ready with our facilities. We are ready with our human resource and so forth.
So what are some of those lessons that were learned during the second wave?
Look, during the first and the second wave, one of the mistakes we made was that the field hospitals, a few of them were decommissioned to a point that when we were hit with the second wave in late November, it took us a bit of a few weeks to be able to bring back our field hospitals. And we learned out of that, firstly, that we should not be quick to decommission our field hospitals, firstly. But if we do decommission some of them, we shouldn't decommission all of them. As a result, between the second wave and now, we had at least 4 field hospitals that were already there, and we continue to utilize. Some of them we were utilizing for vaccination. So right now, we need the beds. It will just be an issue of moving back the beds because the infrastructure is already there. So last time, around November, it took us about 2 to 3 weeks to be able to put up some of the field hospitals back to the level that we had required. For instance, the Royal Showgrounds in Nomagugu, which has more than 280 beds, it took us a bit of time to put it up, but we then have not decommissioned it. We had a number of health workers that we had put on contract during the first and the second wave, but we decommissioned those as well after the first wave, and it took us a little bit of time to get them back into the system. So after the second wave, we decided not to do away with them, and we utilized them in other areas where we needed them, so that when the third wave, or if the third wave hits us, it's very easy for us to just restructure or redirect their energies and their resources. So right now we believe we are ready because we don't need to commission anything new. We just need to redirect the human resources that we have. We need to redirect our infrastructure to do what will need to be done if we need more beds. But so far, we've not had any need for extra beds. We are still utilizing the beds that we have in our facilities, including the new facilities that we created during the first wave.
MEC Mbombo, the situation in the Western Cape, how's it looking for you, and especially the beds as well, as one of the provinces that from the very onset has been very hard hit by COVID-19?
Thank you, Sakina. Indeed, we've got so many lessons learned from the first wave when we were dubbed as the epicenter for South Africa. In the second wave, following the Eastern Cape, where we found that due to the variant that we were also with the second ones that were also hard hit. And now we are ready in regard to the third wave, in as much as that the epidemiologists do suggest that probably we might not have the severe third wave compared to the others, but once bitten, twice shy. So our field hospital beds, they are still there. And also we make sure that we don't have isolated individual field hospitals. Some of them already are embedded in the district hospitals. With the critical care spaces, already about more than five of the private hospitals, they are also on standby in case you might need ICU. But thanks to the dexamethasone, where you now can use high flow oxygen, like in Proteski, where you don't even have to send people to the ICU. With our staff, with the contract staff that we had, even at the time that we commissioned City ICC, we still continue to be appointing them. And actually, there's even one field hospital that is already as an intermediate hospital, so that when you have to decant the beds from these hospitals, major hospitals, we could be able to accommodate them. So we've got still staff that are there. In the second wave, the issue of the oxygen supply is one of those where we found that there was a time there we were going to have oxygen shortages. But with our engagement then at the time with the AFROX and also with the national, we are ready for that part of it. Similar with the quarantine and isolation, we still have them for those people who are unable to quarantine. But Sakina, must indicate that luckily this time, because the healthcare workers have been vaccinated, a majority of them, our numbers do show that at least we don't have a high level number of healthcare workers who are infected or even died. So at least we do have some of the systems, which is the human resource system, that is already guaranteed, that is functional in regard to in case we have got a highest level of the third wave. But again, we appeal to the people to keep on using the non-pharmaceutical interventions, avoid the gatherings, because we have seen, as our numbers are increasing, that the weddings, the golf course, and also all other gatherings, funerals, it's where we find that you end up having these clusters of the outbreak, schools, for example, and all of those. So we appeal to the people to avoid the gatherings, and also to make sure if you are in the space of a gathering, always keep your physical distance. And the issue of the wearing the mask and the issue of sanitizing and washing your hands, but noting it is airborne, to avoid to share your airspace with anyone, especially if you're going to have the events indoors.
MEC Mbombo, you spoke about the vaccination of frontline healthcare workers. Can you give us, as an expression of a percentage, what percentage of healthcare workers in the Western Cape have not yet been vaccinated? And also, you did call previously on more elderly people to actually come forward and register to receive their vaccine. So can you give us an update on that situation as well?
Almost 80% of health workers are vaccinated, but take into consideration that some healthcare workers choose not to vaccinate. And also some of them, they did choose not to vaccinate during the first call, but now they are willing to vaccinate. But some of them, they might not necessarily meet the criteria, the new criteria for healthcare workers, because for now, it's about when you are a member, you have been licensed as part of your professional body. So you might get those that are maybe in the admin, they are not necessary to qualify. With the older persons, in some areas, because we are aware that it might be difficult to register as an older person, especially if you don't have the access, like in deep rural farming and also in some areas of informal settlement. So we do accommodate some walk-ins in other areas. But I think the issue is about the availability of the vaccines. And I'm glad, I appreciate that the National did indicate that they will provide more for the Western Cape. Because the issue is about, you don't want a situation where, let's make an example in the metro, where you find that there's a high demand. Because people, they are mobile, they can just go to any vaccination site. But you don't want a situation where you end up having the farming in the rural communities end up not having vaccines because they all have been child in the metros. Hence, the issue of the equitable access is crucial. So it's not about only that about you want to receive the vaccines and then get rid of them as much as quickly, and yet to leave as many vulnerable people behind. So that's why we ask people to be patient, because some of them will say, we have registered so many people, so why come that you are giving us fewer vaccines? But until that Auntie Sarah, who's down there in the vulnerable areas where actually might not even know what is happening, has also been vaccinated. And we have to be patient and wait until we have got more vaccines in order for everyone else to be able to just to come in and vaccinate.
So what percentage of elderly people have you vaccinated in the Western Cape thus far?
We have hit the 50% mark, which is exciting about it. So at least we have got, I think, 50+% of the people have been vaccinated. Noting yesterday the other areas were closed and the others were open. So we'll know exactly now where are we after I think earlier this morning about that. But that we have hit the 50% market is still quite exciting. But again, we have to zoom in area by area and sub-district by sub-district. As I indicated earlier, it shouldn't be accelerated only when it's only the insured majority that are vaccinated, and then uninsured who would actually be in the vulnerable position, and then these are the ones who ended up not being vaccinated.
MEC Simelane-Zulu, the same question. How many healthcare workers have been vaccinated in KZN and elderly persons as well?
Thanks, Sakina. In KwaZulu-Natal, we have targeted 162,000 health workers, and of those that we targeted, 126,000 have been actually vaccinated, and that makes about 81% of our health workers in the public sector, and in the private sector, we've vaccinated 36,000, which is about 74%. In terms of the 60 years and above, we are struggling there a little bit. Our target is 995 until October. So far, we have vaccinated about 450,000, and that's about 40%. Sakina, I must indicate that we are really struggling and we are quite worried about that particular element, because when you look at the numbers, those that have actually come forward is actually those that are insured or those that are previously advantaged. And when we look at our previously disadvantaged communities, they're actually the ones who are not coming forward. As a result, we have started in the past 2 weeks to have focused intervention in our townships and rural areas, because we think our elderly and our gogos and kudus in the rural communities are indeed not getting the message properly, or they are being confused by some of the issues that are being raised in terms of the theories that are out there on what vaccination is about. So a majority of them are quite worried. But we also have an issue of connectivity in some of our rural areas as the province of KwaZulu-Natal. So the majority of our elderly don't have access to the EVTS, the system that we utilize for registration. So we have then implemented a number of strategies. One of them is to get our community health workers to visit the elderly at home and get them to register them where they live. But we've also decided that we've also decided that the 60 years and above, don't have to actually register for them to come to our facilities. We call on them to come into our facilities. We register them on the spot and vaccinate them on the spot. So we are running campaigns to get the elderly out of their home in townships and in rural areas, get them to come to our facilities to register. Right now, all our facilities, even those that are not vaccinating, all our facilities have a capacity to register the elderly. And every time the elderly visit our clinics and our hospitals, the first question that they're also being asked is whether they have registered. If they have not, someone goes to them and assists them in registering. So we are running a serious campaign in our communities to ensure that our elderly are registered and we bring them to our vaccination center.
So we are now in the third wave, and there is, of course, also evidence of a community-level transmission. So to both of you, MECs, do you think that the messaging systems that you are currently employing are actually reaching the communities? And if not, what needs to be done? And also, I just need you to factor in your respective provinces, where are the hotspots at the moment, and how concerned are you about those? MEC Mbombo, let me start with you, but let me plead with both of you to just keep it short as we are running out of time.
Sure.
Yes, thanks, Sakina. This is not only a health matter, health issue. It needs a whole of society approach in regard to the participation. Because in as much as that we provide a whole lot of information, but it needs everyone from the members of parliament, the members of the legislature, the community leaders and everyone in regard to ensure that some of these NPIs, they are enforced, and also, of course, with the law enforcement officers in regard to the mask and all of those. So that's why we appeal, for example, with the faith-based organizations, which is part of our stakeholders. We hold meetings weekly. We urge them in regard to, do you need to have the whole church to be full, whether it's 50 people or even 100 people previously, we urge for that. In regard to the hotspots, again, where there are gatherings, that's when you end up having clusters. Of course, we've got some districts, for example, in the West Coast districts, because they are linking to the Northern Cape. At the time, that Northern Cape was the first part of the provinces that had the third wave, or they've never been out of any waves. One have to also look in terms of that regard. But again, even the issue of the unnecessary interprovincial travels, because you don't want to try to do the whole of this transmission, the people from moving this side and also the other side. Take into consideration, for example, in the taxis, there is no social physical distancing. So if you're going to travel for the long distances, it will have a huge impact in regard to the transmission. And also, of course, the shopping centers will always have that kind of a challenge. That's why we urge, especially during the SASSA grants payment, because these elderly are being affected, that let's avoid the long queues because those all have an impact. And lastly, in the Department of Education, my colleague, the MEC, has also appealed to the parents that they must make sure that their bundles of joy must avoid the gatherings with the partying and all of those, because infections don't happen in the schools. It's about the people bring them to the schools, and then what we have seen in some of the boarding schools in regard to the infections.
Any specific hotspot areas in the Western Cape, MEC?
Of course, the metro will always be the hotspot because there are many people who are staying in the metro. The West Coast district, especially the upper parts of it, news like now I hear that there's some of the outbreaks in the deep rural farming communities that up there in the north, in the borders there that we have seen, and also, of course, the Cape Winelands, which also have got high densities because they are also nearer to the metro, like the areas like the Drakenstein, Stellenbosch, and all of those. So these are those kind of the areas. And then you get the Garden Route where you might have high numbers in the Mossel Bay, but they keep on changing. But roughly this week we've seen more than 50% of the increase of the numbers compared to the previous week. And yesterday, where we have seen almost 1,300 new cases, it means that we do have a problem.
MEC Simelane-Zulu?
No, thank you very much, Sakina. Firstly, I think what is that we are experiencing fatigue within our communities in terms of messaging when it comes to COVID. So people are getting a bit tired, and they are being Some are being negligent in the process of that. So we are calling on our people to continue to implement the non-pharmaceutical interventions, ensure that they wear their masks, they maintain social distancing, and they wash their hands with water and soap or sanitize where they are able to do so. We have made sure that we again strengthen that kind of messaging in all our communities, in all our deep rural areas, so that the message is clear. We've also made sure that the message is sent to our communities in a language that they understand, because sometimes we will just speak in a language that communities don't understand and therefore only speak to a small percentage of our communities, and those that actually need to get the message, they don't get it. So we've also decided to restructure our messaging in a manner that is understood by the people in rural areas and they are able to comprehend what actually is being said. Having said that, the biggest clusters that we have seen so far as the province of KwaZulu-Natal are within family communities or family members, purely because some of our communities have gone back to holding events, holding the big traditional gatherings that would normally be held during the weekends, during the long weekends, and during the December holidays. Now, December or whatever holiday that you have. So we have called on our communities to make sure that we probably put a stop to that for a few months, and we see what happens in the next 2 months or so. Then they can be able to continue with whatever gathering that they wanted to do. But we've also seen a number of clusters in a few schools within the province, including the day schools and the boarding schools. And we are a bit worried about that, and we are in discussions with the MEC for Education in the province on how we can address the matter. But I do believe we are working very well with the Department of Education. You also wanted to know which are the hotspots in our province. We have 4 districts that are hotspots currently. eThekwini municipality, obviously, because it is a metro and has continued to have the 60% of our daily infections have been coming from eThekwini. We would expect that. And Umgungundlovu district, also as the second highest populated district in our province, also is our hotspot, followed by Utukela and Namajuba. Now, Utukela and Namajuba also share a border, and it does make sense that you would have them being a hotspot because people travel between the both districts, both for work and for leisure. So
MEC,
those are the areas that we are worried about.
I'm so grateful to both of you for sharing that information, but we have to leave it there. Thank you so much. The KwaZulu-Natal Health MEC, Nomagugu Simelane-Zulu, and Western Cape MEC for Health, Nomafrench Mbombo, talking to us about the interventions being made to respond to the COVID-19 pandemic in their respective provinces. It's over to Leanne now for the latest news.